tooth loss will invariably lead to additional tooth loss and an inability to function. The idea behind the concept of replacing lost teeth is to protect any teeth that remain, because they will be overstressed since they don't have a full complement, so to speak, to work on. And by overtaxing the teeth that remain, we're jeopardizing the longevity of those teeth. When I started in the field, there were situations where we would begin the surgical procedure with the idea of placing implants, and we would find, once the tissue was reflected, that there was not adequate bone for us to place implants. We would suture the patient back up, and we would hand the patient some money back and say, "I'm sorry, Mr. Jones, you just simply don't have enough bone for us to do what we would have liked to have done." Today, that's just unacceptable. Today, we can visualize and actually perform the surgery on a computer before we ever go into the mouth. We can actually look at a three-dimensional picture of the site that we're going to encounter in the mouth before we ever see the patient in the operating room. And so we can evaluate the dimensions and even to some degree the density of the bone and anticipate exactly what we're going to find before we set the patient up for the procedure. The technology is spectacular. There's no surprises anymore.